Yesterday, December 7, 1941, a date which will live in infamy. And so, my fellow Americans, ask not what your country can do for you, ask what you can do for your country.
In honor of, and after doing hundreds of shows for veterans over the past 6-7 years, Paul,
yes,
this is going to be one of the most important shows that we're ever going to do. It's bringing a very clear message to all of the veterans, with a very honored guest that's going to bring the message to us. Dr. Aytaman, welcome.
Thank you so much, Ed, for having me here. It's a true honor to be amongst all my veterans with multiple medals.
Skinner, welcome once again. Joe's been a regular guest with us for over the past years many times, and thank you for coming again, Joe. And of course, my co-host is Paul Dietrich, as always. And Paul, I got to thank you, because once again you hit another home run, bringing the right guests, and so we can bring the right message out to the veterans. Dr. Aytaman, what do you do?
I am the chief of GI, Gastroenterology and Hepatology, that's the liver, stomach, and all of the above, at the Brooklyn campus of the VA New York Harbor. And I also co-chaired the Veterans Integrated Network 2's Liver and Liver Cancer team, which is from Albany to Atlantic City.
Wow, you have a lot on your plate. You're a very busy lady. Okay.
Yes.
Okay, Paul.
Doctor, can you tell us, I know that the main subject we're here about today is hepatitis C, and can you tell us what it is and what organs it affects?
Sure. Hepatitis C is a virus, actually, that likes the liver. So it predominantly goes to the liver and causes this ongoing, insidious inflammation that eventually leads to the scarring in the liver, and we call it the cirrhosis of the liver. And then with time, the liver starts failing, and it can also lead to liver cancer if left untreated. It affects mainly the liver, but we know that it can affect other organs also. We know that our patients do have depression that is disappearing after we treat hepatitis C. So we now have enough information that it can affect the brain, the nervous system, and other organs also.
Okay. What else can cause damage to the liver besides hepatitis C?
So that's a very important question, because as you know, the biggest damage comes from alcohol, and in general, alcoholic liver disease used to be the leading cause of liver damage in the United States. Unfortunately, hepatitis C surpassed that. And if you have hepatitis C and drink alcohol on top of it, it's a very bad combination. I really wouldn't recommend that. If you're going to take 30, 40 years to develop cirrhosis, if you are drinking concomitantly alcohol, you can develop cirrhosis much faster, in 20 years. So we usually don't like that. Also, any medications you take, all those things go through the liver, and you really have to check with your provider which ones are going to be more harmful and less harmful.
Okay. Well, we're here talking to veterans, and of course the concern amongst the veterans is going to be what is the incidence of hepatitis C among veterans compared to the general population?
So that's a very good question. This is actually how my career started, because when I became a VA physician in 1990, we just had described hepatitis C antibody, and we didn't even know how to test the virus yet. And we started seeing, because VA tests immediately, we started seeing a very high incidence of hepatitis C in our veterans. And we did a testing day in 1997. And we tested every veteran who got blood transfusions that day and came up with a percentage of 6.5%. General population incidence, which were really not accurate data at that time, were 1.2%. So we said, oh my God, our veterans have a much higher incidence. But now, as we start testing globally, we are realizing that the incidence, the virus is mainly in the baby boomer generation. 70% of hepatitis C in the US is in the baby boomer generation born between 1945 and 1965. So that generation really needs to be tested. It's not only a veteran's disease, but it's that baby boomer generation. VA tests everyone, but if I would go to a mall, Staten Island Mall, and test everyone walking through the door, I might come up with similar values. Currently, we went up to 3.6 million people infected from 1.2 million at that time in the general population.
Yes, so it was just that we didn't know how widespread this was.
Exactly.
Not that we're experiencing this epidemic at the moment.
Well, actually, I would not say that, Paul, because with the ongoing and incredibly disturbing opioid epidemic, I think you addressed this recently here. With this opioid epidemic, all of a sudden, over the past 2 years, we are seeing again a blip in the new hepatitis C infections in our younger generation, really. And therefore, I want to go with my mobile VA van to the college campuses and test the young people who are taking the GI Bill, really.
Right. Yes.
It's a big issue, and that needs attention from all of us.
What are the symptoms that you see if you have hepatitis C?
So I'm going to say what I hear from my patients, but I think Mr. Skinner can tell us also. The most common symptom is fatigue. And who doesn't have fatigue? So most patients ignore it. Most patients consider that low-level depression, low-level fatigue, their baseline. They don't even realize that this is from the disease. It's until the liver disease is very advanced and liver starts failing, that's when we start seeing symptoms. We start fluid filling up in the tummy, patient getting confused because the liver cannot clear the toxins. It doesn't make appropriately certain clotting factors, so you bleed easily. Those are all at the very end. Most of the time, patients will have only fatigue, perhaps sometimes some right-sided discomfort. What do you think, Mr. Skinner?
Anxiety, frustration, and what wasn't mentioned and lays dormant in your body for years. I found out after 20 years that I had hepatitis C. And I actually had an argument with the doctor. He said, you had hepatitis C. And I just told him no. And at the time, I asked my then girlfriend, who remembers everything, and it was over 20 years before they discovered that I had hepatitis C. And, what a relief. I came to the hospital they told me I had about a year. They were testing this new drug, and a year and a half I came to the hospital and I asked about the new drug, and they said, matter of fact, you're here today to start the Havoni. I didn't even know the name of it. And we were talking about what a relief. It's a 12-week program. The pills are very expensive, but once I began the program, within a month, my viral load was down to 0. But it's a 12-week program, and it's such a relief knowing that I don't have this antibodies in my system anymore. And like you spoke about the cloud, there was a cloud, you were so right, lifted from me. And I felt like a new person. And it's just like beginning life all over again without this in your body. And I tell everybody about this. And from what I know of, everybody I spoke to, it's supposed to have a 99% success rate. Everybody I spoke to says I'm Hep C free. As far as the antibodies, there's antibodies are 0 in my body. And
it's actually the virus.
The virus.
Antibodies can stay with you a long time, but it's the virus we cannot detect after we completely eliminate it. And you're absolutely right. This is what I'm hearing from the patients, that cloudiness of mind, and this can affect really brain functions also to some extent. Depression, fatigue is gone. They have more energy, and some of my patients were telling me, now I remember that how much money I lent to my wife and things like that. So it really is.
Or nowadays to their husband.
Right.
Exactly.
Yeah.
So
I actually tried 3 times with this drug as far as trying to take in
the
treatment with ribavirin and
interferon.
Interferon with the ribavirin, and twice it went down, but it came back up after a minimum period of time.
So that's been our life story, actually. I used to give these miserable drugs. I mean, interferon is an injection, actually, and it makes you feel like you have the worst flu ever, but for a whole year. Aches, pains, shortness of breath, anemia. We have to check the blood tests constantly, not to mention patients became like pincushions. And really miserable drugs. They made my patients miserable. They made me miserable because I was constantly scared I'm going to kill one of them. They had so many side effects. And I never thought that there will be a magic pill that's going to be available one day for me to cure my patients. I never thought that. So when this Australian doctor, Dr. Edward Gain, at the liver meetings, told us about 10 patients, 1 pill a day, 100% response rate.
Yes.
There was not even, you could hear a pin drop in the auditorium of 5,000 people.
So what type of side effects do you see with this medication, doctor?
Compared to the interferons and ribavirins, we really don't have any side effects. We do see some fatigue during the therapy, some headaches that can be treated and respond to Tylenol. And really there is no significant side effects. We don't need to check the blood tests. We don't cause anemias, no flu-like symptoms, no depression. Before, most of my Vietnam War vets were not candidates for interferon-based treatments. They had post-traumatic stress disorder, and this interferons made them depressed. And I had patients who became suicidal. I had patients who became homicidal. We had to get the FBI to bring them to the hospital. So these medications, I can give them without any fear of exacerbating their depressive symptoms. Mr. Skinner, did you have any side effects?
Not with the Havoni.
That's what we are.
Well, with the interferon, I walked up a flight of steps. I had to lay down. I was so fatigued and exhausted. But with the Havoni, first of all, I never read the side effects on each drug. I just didn't want to read it. I just wanted to go on and live my life. It's like nothing happened. But I remember with the interferon, it was so fatiguing. No matter what you did, you were always tired. It's just, it doesn't matter what you did, you always tired. With Havoni, it just, I felt no side effects at all. None whatsoever.
That's what we hear from most of our patients, really.
That's a plus.
Yes.
It's a plus, big plus. I mean, the fact that you don't have to inject yourself, the fact that you can take it by mouth, the fact that they have virtually no side effects, they are all making this an incredible drug.
Can we cure Hep C?
I never thought I will say this for any virus. We do not have a single virus infection that we can cure. But if you don't have cirrhosis, we give our patients a certificate and it says you are cured of Hep C. Usually we never use that term. But if you haven't developed very advanced scar tissue, Hep C is cured. We can cure Hep C, and the whole goal is to catch our patients before they develop advanced scarring and eliminate the virus. So that's why we are here. I want all our veterans to come and get tested so that we can find out about it and immediately put them into treatment arms and eliminate hepatitis C. Also, we are seeing resolution of that stigma. You know, everybody knows this is a curable disease. They are more comfortable coming here with their wives and children, getting tested and getting rid of the virus eventually.
Very important.
Very, very important.
I think also it's important, I've heard that if you continue without treatment, that it's possible that you could end up with liver cancer.
Absolutely.
Oh, absolutely. That's one of my, now that we can cure hepatitis C, and I don't consider Hep C a big issue anymore, all my efforts are turned to liver cancer. Liver cancer is the fastest growing cancer in the United States. Fastest growing, faster than any other cancer in the US. It's due to the hepatitis C epidemic in the baby boomers. Baby boomers are aging and they are now coming down with their cirrhosis complications and liver cancer. And the other main issue for the liver cancer is the obesity epidemic. We sit in front of our TVs, we eat junk food or processed foods, and when you look at the map of the United States and look at the BMIs, body mass indexes, weights of the patients, our maps have changed drastically. Most of our patient population is obese, and quite a bit of them are morbidly obese. And that can lead to cirrhosis of the liver with fatty liver and liver cancer. So we are dealing with all these things that can additionally cause damage. I give my patients, after we finish treatment, a letter stating that they have to watch their weights. Now that they feel better, they shouldn't go out and start eating junk food. Actually, I tell them I will kill them if I see them in front of a McDonald's or Kentucky Fried Chicken or one of those fast food places. I want them to cook at home, get the right ingredients, eat healthy, live healthy, and exercise regularly.
I guess liver transplant becomes a final option if all else fails.
Absolutely. I mean, liver transplant was a dream, and now it has become the standard of care for our patients whose livers are too far advanced or with liver cancer. We are using liver transplants. I don't know whether you all know that, but the first ever liver transplant in the United States and in the world was done by Dr. Thomas Starzl, who died this year, who was the pioneer of liver transplantation in Denver, VA. It was actually a veteran.
A veterans hospital.
Yes, Denver Veterans Hospital was the beacon of liver transplantation. And our patients in Brooklyn and in the New York area get transplanted in Pittsburgh, VA. And we have multiple transplant programs, but it's the closest to us. We have a very good system of shipping our patients there. They come to the Teterboro Airport in Jersey, and from there, with a private plane, we get them to Pittsburgh. And we just had actually one of our patients receiving liver kidney together.
Yeah, you were telling me that earlier. Yes.
So, and we were so extremely happy for that. Another one just got a liver also, and a third one we are in the process, we can hear any moment. This is only past few months. So liver transplant really is a gift of life. I mean, I personally go to motor vehicle places and pledge with everyone, please become a donor, and if you are trying to take care of a very sick patient who is getting confused every few minutes, we have to take out from the tummy liters of fluid every week to make him breathe comfortably, then you will understand what it means, that gift of life. It really saves lives.
Suppose the person is still using illicit drugs or alcohol. Can you still offer treatment?
Absolutely.
Okay.
The only people I cannot treat is if they cannot comply with the medications, because not only that they are expensive, but more importantly, if they don't take it regularly every day and skip doses, this is a very nasty virus. It immediately develops resistance to the drugs, and we do not want that. So we look at drug abusers who are more stable, come all their clinic visits, and can really comply with the complex medication regimen. Of course, we want them to stop, obviously, and we created these joint teams with our mental health teams, alcohol rehab, drug rehab programs. We like them to be seen there, but we don't pressure them like we used to do it in the past 6 months of sobriety or what have you, and we still try to treat them because the epidemic is there.
Yes.
Unless we clear hepatitis C there, we are never going to completely eradicate this virus. So the biggest issue, in addition to alcohol and drugs, is homeless veterans, which breaks my heart. I have been going to shelters, to veterans shelters, but unfortunately some of them don't stay there for 3 months. They are out of the system, then they go show up somewhere else. Those are the most challenging patients for me. So I am trying to set up this program with the mobile VA van to go to areas where they are more concentrated and treat them right then and there. But it has tremendous logistical issues.
Yes.
So.
Can I say something? What scared me most about this whole Hep C in the liver, my father was an alcoholic, and he died from cirrhosis of the liver. And that's what really scared me the most when I found out I had Hep C.
It is a nasty virus.
Yes.
There is no doubt about it. I mean, my whole life has been treating the damage caused by hepatitis C, and I hate it with a vengeance. You know, VA is a closed system. Most of my patients, and I have quite a few patients in Staten Island, I know since early 1990s. I know the children, I know the colleges, I know the wives, you know, and to see them die of this disease is a very traumatizing
Yes, it is.
thing for a physician. So all my life I dealt with the problems caused by it to this day. You know, the
Now
way
you
I
have an
find
opportunity to destroy the
absolutely.
problem-causing issue.
Absolutely.
Yes.
So I need all of your help to get veterans come to us. We have the South Street Clinic, right?
Yes.
You all
Yes.
are using it. They can go there to get tested. They can come to Brooklyn. They can come to New York. And we will be actually on the 29th in front of the War Memorial in, what was the park? In Staten Island.
It's
Midland Beach.
Midland Beach,
yeah.
exactly. We will be there with our mobile VA vans. Please come. We will offer free screenings with finger sticks for hepatitis C, HIV, glucose, you know, sugar, diabetes, and blood pressure, vaccinations. We will be offering all of those there. And if you have a program for veterans and you want us to be there, just let us know.
Yes.
Well, I got to tell you, number one, you were to be commended because I have never met a doctor so passionate with love for the veteran and for the VA than you.
They gave me a huge purpose for my life.
Okay.
And I was an immigrant and came here like all immigrants come with the same issues. And I never felt like I belong here. Do you know when I felt I'm an American? 9/11. I had multiple firefighters there who were taking interferon injections, and Mr. Skinner just told us what that meant, and they were there. We didn't even know whether they were alive for like at least 24, 48 hours till we got contact with them, and that's when I knew that I am an American. I work in the PTO, parent-teacher organizations, the kids, my veterans, you know. Who is more American than that?
It's a wonderful thing. It really, truly is a wonderful thing.
And
I'm honored to have you on the show.
Thank you
I'm honored
so
to have
much,
met
and
you.
thank you for having me. If you can spread the word, that would make my day.
Okay. And I know we were talking in the green room earlier about the epidemic is beyond veterans.
Absolutely.
Okay. And you wanted to be able to reach out to the general public as well as a veteran in public.
Right. Thank you for bringing it up, Ed. We have also our community partners, Hope, with us that day, and whoever is non-veteran or non-VA care eligible veteran, please come. We will still offer you screenings, and believe me, we will try to get you to therapy no matter what. With my other hat, I am the governor of American College of Gastroenterology in Brooklyn, and in Staten Island, and in Brooklyn, and in Manhattan, and across the nation. There are so many kids we have trained. I shouldn't call them kids, I'm sorry, but so many physicians that we have trained. They will have their doors open to veterans and will do anything possible to get them to therapy.
You mentioned you had that map with the pins.
Exactly. We recently created this Google map of the United States with all the fellows that we trained in the Brooklyn VA. It's over 250 of them in my lifetime and a bit beyond, and we have pins all across the nation. There is just a little bit of an area right at the center in Alaska, we have no one. Even Hawaii, even Puerto Rico, Nassau, all over, we have alumni.
It's a wonderful
And
thing.
they will do anything for veterans. Otherwise, I will kill them.
Let me say, if you're a veteran, just come on in and take the test. And if you have it, come in and be treated. And that's to everyone. It's not something that's going to kill you. And don't be afraid. It's here to help you. And I was helped tremendously. And like I said, that cloud is gone, and I feel tremendous.
So I want to just say and commend my vets for something. When we got these new drugs, I want to give you an idea about the numbers that we are dealing with. Before 2015, when these new pills came into our hands, in the past 15, 20 years, we had treated 40,000 veterans.
40,000?
In 15 years. In the past 2 years, I just looked at today's numbers, we are at 92,000.
92,000.
We are trying to achieve 100,000 veterans treated goal by the end of the fiscal year, which is September 30th. So that's the amount that we put in. I have to give tremendous credit to our HEP C HIV group, Dr. David Ross, who reorganized us without asking the government for additional people to hire. We reorganized and trained all our pharmacists, infectious disease doctors, GI doctors, liver doctors, some primary care doctors, nurse practitioners, physician assistants, and by training them, utilizing the telehealth technology, we increased the volume of treaters. In 2 years, we treated more than double the amount than we treated in the past 15, 20 years. So I really am very proud. And Mr. Skinner will tell you, we don't wait the patients to come us. Every patient who has a positive test in the VA, we have it in a registry, and we started calling them. And when I sat down with my patients and I said, I want to treat the cirrhotics first, they have been wonderful. They said, of course, because they put for each other their lives into danger. They know what it means to treat the sicker one first. We finished the sick patients in less than a year, and we're treating everyone, and they all waited patiently, and we are not going to leave anyone untreated. So in our facility, we are now at a stage we are calling, begging the patients to come in. Some of them still have reservations. They say, Doc, I am doing well. I don't want to have side effects. And I am begging them, these are really without side effects. There, Mr. Skinner can do a lot, more than what I can do.
Thank you. Well, we're coming to the close of the show, but the message to the veteran out there and the veteran's family and to everyone in general is get screened. Find out what it's all about. If you have a problem, it can be fixed easily. It's not like something traumatic. I mean, the effects are great. If Joe Skinner's gone through it, and trust me, if Joe went through it, anybody could go through it.
And it's only a 12-week program.
Yeah.
Most of the time, some patients we are treating with 8 weeks. We are now a couple of new medications in the horizon in August. Approval is expected, and we might get it in the VA in our hands within a month or two. And those new medications, a lot of them will be 8-week regimens. So depending on how sick you are and how many times before we have treated you, we might get away with 8-week regimens also.
Well, Doctor, I'd like to thank you for being here. It truly is an honor for me to have you here.
Thank you.
And
The
it's-
honor is all mine.
and
I
it's-
mean,
it's an honor
I
to
love
bring the
my
message.
veterans, and I want them to come to us. VA is there for them. If they have any problems, my contact information will be with you, and just let me know. No matter where you are, you don't have to be in Brooklyn, you don't have to be in New York. I will still get you help.
Okay. Is there a phone number they can reach you at?
Yes, they can call the Brooklyn VA and they can say, connect me to the liver team, and they will immediately connect them to the liver team.
Very good.
And I'm going to leave you my number so that you can post it online.
We will do that. Thank you.
Please come to the event on the 29th and help us eradicate hepatitis.
At Midland Beach, and you get a screening for everything that you get down there. And believe me, as I said earlier, I have never met a doctor with such passion and love for the VA and for veterans as Dr. Aytaman.
There
I
are a
am
lot of
truly
them.
honored.
There are a lot of them. I am not isolated. Thank you, Ed.
Joe
Thank
Skinner,
you.
thank you once again for taking
Yes,
part
Joe,
and
thank
helping us get through this. And thank you for bringing him, Doctor, to us. And what else can I say? But thank you as always. Okay.
Thank you, Paul.
Thank you.
You're watching in honor of. It's been our honor and our pleasure to bring this show to you. You keep watching, and we'll keep bringing you important shows as today's is. Thank you.
And now our next guest from the VA, Lyn. And by the way, Lyn is a veteran of the Marine Corps, and he also is the outreach specialist for the VA in Manhattan. Welcome, Lyn.
Thank you very much. Thank you for inviting me.
Lyn coming to us today is just an indication that the VA is going out after you to help you, okay? They're going to take you by the scruff of the neck, and they're going to help you and say, listen, you need this, and we're giving it to you, you know? It's as simple as that. And for the family of the veteran, if he don't want to listen or she don't want to listen, well, you can take action and get help, because the VA is there and they're offering so much good for anybody who served this country in any capacity.
Thank you, Ed, for inviting me, and thank you also, Paul, for inviting me out here to Staten Island to talk to you about some of the changes that the VA is now trying to implement in terms of veterans accessing their benefits and services.
Okay.
Yeah, well, there's a few things that has been going on lately. Around the country, many of the VA facilities have been mandated now to go out into the community and bring veteran services to the veterans. What we're seeing at the VA facilities, whether it's at the VA hospitals, regional office, or even the National Cemetery, many veterans have not been going to find out information about what benefits are available to them and their family members. So with that being said, the VA has now created positions known as outreach specialists. That's who I am. With my role as an outreach specialist, I'm now mandated to get out the building and go find veterans where they're at and bring the services to them. With that, I now have the usage of a VA mobile unit fully stocked that I bring out in the community, whether it's at a local VSO, a community college, wherever I think that there's veterans and their family members, we can do actually real-time services to these veterans and have them sign up for benefits on site without them having even to call an 800 number or having to mail in information in order to access their benefits.
What are some of the services in that mobile unit?
All right. Some of the services we have is actual enrollment for the VA ID card. The VA ID card, when you're enrolled, that's basically your access card in order for you to use any medical facility throughout the United States of America. We do actual on-site. I have a crew there with mobile laptops. They can go online right then and there. If you have copies of your DD-214 discharge papers, we can sign you up right then and there on the spot for VA healthcare. Along with that, if you A veteran might have some symptoms of PTSD or some medical ailments, different things of that nature. What we can do is actually, we have 2 exam rooms on that mobile unit where we can have as little privacy booths where they can meet with a clinician on site on that medical mobile unit and get some of their any services that they may need in terms of medical care, get an initial assessment done right there on the spot. So by the time they even come down to the facility, some of that services has already been started.
Very good.
I think the real important thing that we're talking about here to the veterans out there in the community, or to the family of the veterans, is you've got to reach out, you've got to get to the VA. Here's an opportunity for a VA to come to you to get signed up so that you can be taken care of. The services that you earned, your service earned you the right to go to the VA. We just recently had Dr. Aytaman on here talking about hepatitis C. That's only one of the many services that are available there, but you have got to reach out to them to get that help. And here's a perfect opportunity.
I think it's important to know that not too long ago, the rule of thumb was if you didn't go to the VA, they didn't really much care.
No.
You know, in other words, it was up to you to go to the VA, to go to the VA hospital or whatever, to sign up to get checked in, but they didn't reach out for you. And if you didn't go there, you just floundered wherever you were, and you weren't going to use the VA, you weren't going to get it. And now the VA is reaching out into the community and saying, hey, we're here, we're going to help you. They bring a mobile van around, and according to Dr. Aytaman, the van can do your blood work.
Correct.
And instantaneously. Instead of going and waiting, not even to the VA hospital, going to a regular hospital to get your blood work done and waiting for hours. Here you got the van, they're coming into your community, they're coming to you and say, we're going to help you. Come on, take 2 steps into this van, because once you're here, we're going to do everything we can for you. And a lot of veterans let the VA go by the wayside. And they say for whatever reason, they don't want to be bothered with anything remotely related to military. They say it's over with. I did my bit. I'm finished, and I don't have to. But the truth of the matter is, you're entitled to a lot more, and that's where Lyn comes in with the programs he's done. Just talking to Lyn 20 minutes before we taped the show, I've learned a number of things I myself wasn't aware of. Simple little thing he just said to me a few minutes ago. He says, did you ever think of sending out for your military records from the...
Correct.
Yeah. And I'm willing to bet you 9 out of 10 guys out there wouldn't think of sending for their military health records. Just to tell you that what may or may not be on paper that may relate to whatever you've got problems with today.
And that's correct. That's a good point, Ed. What I want, another thing, a point I wanted to make is on that mobile unit, we bring out the forms. We always ask every veteran, did you ever request any of your military records, service records? And if the veterans say, no, I've never requested them, but I may or may not have went to sick call while I was on active duty, we say, look, we'll help you fill out the forms. We'll send the forms in for you. It's nothing really that you're going to have to figure out. We're going to help you on that mobile van to fill out the forms. We'll send the forms in to you. And right now, it's been really a quick process with St. Louis sending the records back to the veteran. It's been taking a turnaround time of no less than like 2 weeks. And even if they were not able to find your records, they'll at least correspond back with you and say, hey, this is, we haven't found your records, but this might be another avenue. Maybe reach out to your local branch of service. Maybe they might have the records, or your local regional office. So these are some of the new services that we're looking to bring to veterans. And another thing is, with me being an outreach specialist, I don't have my eyes and ears everywhere. I need veteran service organizations to partner with me and to get the word out to their local VSO community and say, look, this is what the VA is looking to do. Maybe we can do an event at our local veteran service organization where the VA will come out. Maybe we can have, a little light refreshments or some coffee and donuts, and we'll have the VA come out and we'll make this a full-day event. I already got authorization from my director of the hospital. She said, Lyn, I support you in whatever you're looking to do. So she said, look, even if it's a Saturday or Sunday or Saturday evening, I know the weekends, but it doesn't matter. I mean, for veterans, like I said, when we served in the military, it was 24, you're on duty 24 hours. Yep. That's the way I look at this. So if the VSO, they only have their meetings on Saturday evening, I need to load that van up and be there on a Saturday evening. The only problem I have, I don't know where all the veteran service organizations in New York City are. Yep. That I need your help with.
Well, like Lyn just said, you can reach out for us here at the station at 718-727-1414, and we will get that information to Lyn right away for any of the organizations.
Would you like to give your phone number?
Oh, yes. Matter of fact, I can give the number. This is our 800 number that we use for our mobile outreach team. It's 888-762-0132. I repeat it again. That's 1-888-762-0132.
It's very important.
Do you have any dates currently scheduled where you will be in the New York City region?
Yes. We currently have an event going on within the next 2 weeks. It's going to be Saturday, July 15th at the St. Albans campus of the VA. That's going to be we're going to be doing dental screenings, medical screenings, along with HEP C treatment with Dr. Aytaman, who is currently on here, talked about. Also, we're going to have the VA regional office, who are going to be helping veterans sign up for claims for any injuries that they had that same day. And also, believe it or not, we're going to have the National Cemetery Administration going to have representatives there also. A lot of times when we talk about the VA, we always talk about the health care and the GI Bill benefits, but we need to also talk about the National Cemetery. Those are other benefits that you and, if you're married with a spouse, may qualify also. So we're going to have all those three VA service providers there. And another event that we're going to be doing at the end of July is Saturday, July 29th, and it's going to be right here in Staten Island at Midland Beach Veterans War Memorial. I'm going to repeat that. That's Saturday, July 29th, an all-day event at Midland Beach Veterans War Memorial. We'll be providing some of the same services that we were going to be providing on July 15th.
And that's right here on Staten Island?
Correct.
And it's from 10 a.m. to 4 p.m.
Okay.
So this is your opportunity to get out there. You don't have to go far. Get signed up, get into the system, and then see what's there that can help you.
And for any of the organizations outside of Staten Island that see this show on YouTube, because this show goes on YouTube, as soon as we have it edited, it goes right up on YouTube. If you go on YouTube and you go into my name, Ed Salick, and you'll see all of the programs listed there that we do with the veterans. And if the veterans organizations outside of Staten Island, you can reach out for Lyn on the number he just gave us. You want to give that number again, the 800?
It's 1-888-762-0132.
Okay.
And we are trying currently to line up some additional events here on Staten Island, realizing that Staten Island tends to be the forgotten borough. We're out here at the furthest part of New York State, and it's difficult for us to get off the island easily, as you found out getting here today, obviously. But we are planning some other events. As soon as we have confirmed dates for that, we'll get that out to you. But again, this is a perfect time for the veteran service organizations to link with the VA to try to get the information out to the membership and to the other veterans that are not members about what's out there and what's available for them.
Okay. I'm going to go out on a limb and say any of the Rolling Thunder events that are coming up on Staten Island that we'll get Lyn to be there, be part of it. I know they got a couple of things going at the Marine Corps League, and these guys are all about helping the veterans. So it's a positive thing.
The VA is there for you, the veterans, and if we don't utilize it, it'll go away. It has to be utilized for the veterans, for it to stay in existence. I know there's choice programs, but choice may be very nice if you live in a place like Utah where there's not a VA facility close to you, but otherwise, it would be to all veterans' advantage to take advantage of what is out there in the system and utilize it. Choice is really designed for places where there are no facilities available in a proximity for you to get to.
Well, Lyn, I want to thank you for being here with us today, and you rounded out a perfect day of showing what the Veterans Administration can do for the veteran and what it means to the veteran, and hopefully the message will be out there and these people will pick up on it and take advantage of it. I can't thank you enough for being here. I do want to invite you to come back whenever you want. Okay, we can do this, and anytime there's any new programs, we'd love to have you there.
Thank you for inviting me.
Paul, as always, thank you. You've been watching In Honor Of. It's our honor and our pleasure to bring programming like this to you to benefit the veteran, to benefit the veteran's family, and to benefit the general public with more awareness about what the VA can do for you. Thank you so much for watching.
Yesterday, December 7, 1941, a date which will live in infamy. And so, my fellow Americans, ask not what your country can do for you,